Welcome back to Questions You Didn't Ask with me, Naisha Frey, and my guests, Regina Main, Dr. Denai Fannin, and Felicia Williams Brown. As we continue the series, COVID-19 Conversations, Black People with Disabilities. Let's dive back into the discussion.
Listening to you talk, it also reminded me of how there was limited supply, like from toilet paper to whatever. And my son, because of his sensitivities, there's a certain chip that he will eat that is a staple to his diet, and the stores were not stocking them. And I remember having coworkers, family members, they're all looking out for these chips. And we were communicating by Zoom, of course, but we would get boxes of these chips from all over the place when people would find them because we couldn't find them. Right. I mean, it was so funny that there was we had an interview with a local newspaper about my son and these chips.
Oh, wow.
Seriously.
Wow.
Yeah. Yes. And so I say all of that to say, even when I look back and I think of, because it's wild to think we lived through that, right? Mm-hmm. And there was a lot of funding that was poured into it eventually, but now those funds are drying up. Right. And some supports that people started to rely on are no longer there, and people are still slowly getting back to their therapies and the stuff they had before. A lot of us are still not there.
Right? People in 2022 were like post-pandemic, and I was like, there's still COVID. What are you talking about post-pandemic? It's not post-pandemic for everybody, but it's, we had the Tyson natural nuggets. Yeah. Stop making those. So I go online asking, and then Trader Joe's, they've stopped making the cereal, the strawberry yogurt.
It's a certain type, right?
And they're like, have you tried the cheap?
Yes.
First of all, yes. We tried to right. Yes, but she can tell, and that's something that people think we're permissive with the food. But I'm like, she really will not eat, and so and they don't make those anymore, but they have them online at Amazon, so it's like $20 a box. But I'll get that to get through the week. Wow. But it's I don't know. Now she doesn't eat chicken nuggets. Because she didn't have the brand, so now we're worried. She's not getting any protein. She's a vegetarian right now. But people don't think about that. The extra little things that keep me up at night.
Right. And that's interesting too, because where I want to kind of shift this conversation is thinking about, when you're talking about food preferences, right? We know that their kids could be kids, right? But there's more to it with some of our kids. It makes me think about food pantries, right? And how they want to be helpful to serve communities, but it's kind of get whatever is here and be happy, right? So when you think about organizations and services or programs, what organizations inspire you in your advocacy especially for Black people with disabilities? What are some things that are either starting to percolate, or organizations that are starting to, and it could be your own, right? That inspires you in this advocacy work?
I can share. There's several. There's a program called Faces, and I've been fortunate to be able to partner with them to be a facilitator of that program. But Faces is a program started by Dr. Pearson. She is through NC State. And the idea is to educate Black families of autistic Black children, to teach them how to be empowered and to advocate for themselves. And I've seen the curriculum, I've worked closely with it. It is phenomenal. And it's very inspiring to me, because it's like, wow, it's really good content. It's not just stuff, it's really life-changing stuff. So that's one initiative. Another, Teach has created this online interactive website called BFAST, and it is specifically for Black families of children with autism that connects them with Black providers, people like us. It's like the goal is to empower us to get what we need from our community. And it's very early in its stages because they have so many plans for this project, but it's called BFAST. And it's great. They have different stages. It's like throughout the different stages of your life, there's stories on there. There are very like robust resources on there. So that's also like specifically for us, a very beautiful thing that's inspiring. Another is Autism in Black, which some of you may or may not have heard of them, but that organization is actually based out of Florida, but they have this huge conference, online conference, every year. And I mean, it's a 3-day conference. They have speakers, they have topics that are relevant to our community, tools, book lists, all types. It is just robust, is phenomenal. That is also something that's, inspiring. It's like, yes, like we are actually touching our culture, our people, and we're helping. And then like my organization, Pioneer Change, like that has inspired me to create content that you hear talked about at the tables all the time. People acknowledge, they say, oh yeah, that's a problem, but then it's like, okay, now what do we do? Like, what do we do? Like, we recognize it's a problem. Now we need to do something. We need to empower ourselves. So I've really focused on topics that you don't see a lot, but it's relevant to our community. So yeah, there's a lot happening out there that's very, Alaka also, that is an organization that is amazing. You've heard of it? Yes. They are doing some very powerful things. So their goal is they started out supporting siblings, but now their focus is trying to promote policy change so that families can be compensated for what they do. Like, for example, if a caregiver drives their child to an appointment, they don't get reimbursed for that. But if you hire a Medicaid-approved driver, then they will pay them. And it's like, well, why not bring those funds into the family? Then more families could be providers and could support and could take care of a lot of these deficits that we're seeing. So they're very forward-thinking, doing some amazing things. So yeah, those are some organizations that stand out to me.
Right. One of my colleagues at North Carolina Central University, Baina Mohammed, is a history professor, but she did her master's in policy at NC State a couple of years ago. And for her thesis, she put on a conference. She started the Black Disability in North Carolina network. So that organization, so it's newer, but she had a really great conference and turnout for that. And she has 4 grown sons, and she raised them and and she was a Land Scholar also. So her organization, there's a professor at UNC, Brian Boyd, in education, and he started the BEAM organization, which stands for Black Empowerment in Autism, and it's Black researchers, Black autism researchers. So it's interdisciplinary, it's nationwide, international. We just got an article accepted about, they reported the recent narrowing of the gap between Black and white children, their identification of prevalence in the US, the CDC study. And we're saying that, this is great, and we're saying, well, Black children are still not getting the same access to services, right? They're still getting these misidentifications in school, these identification as intellectual disability instead of autism. And I want to be clear, there's nothing wrong with intellectual disability, but the classroom structures are set up differently when, between if you have the self-contained autism in the classroom or integrating them, mainstreaming them. So that article is coming out soon. And so it's just a bunch of us getting together to conduct research specifically for the Black autistic community. So we're working on the website for that. There's another group, All Neurotypes. So Sam Branston works at Duke University for the Duke Autism Center. And he started that group. And what I like about it, he's autistic, but what I like about it is that they have counseling and they have groups, social groups for neurodivergent people, and providing specific therapy. So they have counselors, speech pathologists, and so on. I spoke to the North Carolina Speech Language Hearing Association a couple months ago about social skills in schools, and I said, as a parent, my main concern is my son being able to make friends. That's his concern. There's a high suicide rate for autistic people, right? And so if the speech pathologist at school can help facilitate those friendships or stop bullying, I'm more worried about that than what language activity you're working on. So, even though that's my job as a speech pathologist, that's what's really worried about parents. First, getting them to school, are they happy? But that's what we have to focus on. So the All Neurotypes group, he has a YouTube channel and they talk about the bullying and, it's autistic people. And he also runs that neurodiversity group at Duke to help make the college campus more inclusive for autistic college students.
So kind of along the lines of that is, I see more groups getting together in a collaboration. It's one mental health / substance use group called Black Cares that I chime into their workshops and different things of that nature. Locally, it's in Raleigh for recovery and dual diagnosis, recovery communities of North Carolina, and that's operated by Dr. Linger, who is phenomenal worldwide, but she really highlights the Black community and needs and services. But yeah, I can't think of specific groups other than I know Victoria pretty well. She's on the committee with me. I think right now we're in a place where people are starting to branch out and create those spaces and organizations, but it's been more of a collaboration that I've seen of a group of service providers getting together and trying to formulate. And so I see more group style things that you can find on social media versus the actual organization.
Well, ladies, this has been wonderful. I'm going to make sure that our audience knows exactly how to get in touch with you, and that they know that can learn more about your expertise and different services that you're providing and organizations that you're affiliated with. But I just thank you so much for sharing so much about not just your profession and what your expertise is, but about your family life and your personal life and the things that matter to you. And also just shedding light on the unique experiences of Black people with disabilities, and how COVID impacted us in very specific ways, and impacted you individually as caregivers as well in some very specific ways. So I just want to thank you so much for being here and being a part of our first video podcast.
Thank you.
Thank you.